For the past 6 months, 13-year-old Timothy Donovan has been experiencing strange, seemingly unrelated symptoms. A high red cell count, debilitating fatigue, and chronic bronchial infections, and no one knows why. Now, a routine chest X-ray provides a clue.
I said, we've got it. Tim had an arteriovenous malformation that was very large.
Arteriovenous malformations, or AVMs, are abnormal masses of blood vessels that form in the internal organs. For Tim, it is in his lungs.
He had a ball of blood vessels bypassing the capillaries in the lung, bypassing the circulatory system, and bypassing the pulmonary system, therefore maintaining a chronic kind of lack of oxygen in his system with his body responding by increasing his red count. And I felt we've had it, but so I had, on one sense, a level of like relief and aha. On the other sense, I said, oh no, what are we going to do now?
Doctors believe that AVMs form in utero or shortly after birth. They don't know exactly what causes them, but they do know that AVMs can be indicators of more serious conditions. The Donovans immediately send Tim's records to Dr. Robert White at Yale, who specializes in the treatment of AVMs. Dr. White calls the Donovans immediately.
And he explained who he was to my husband and asked if there was another phone, and he said, put your wife on.
I just had to ask one or two questions. Kathleen told us that this boy wasn't thriving. There was something wrong.
Then Dr. White asks the one question he knows will clinch the diagnosis.
Is there a family history of nosebleeds? Once I got the history of Tim, who had mild nosebleeds, and his father had definite nosebleeds, I knew we had a patient with HHT.
HHT, or hereditary hemorrhagic telangiectasia, is a rare genetic disorder affecting only about 500,000 people worldwide. HHT can prevent the body from forming capillaries, the tiny blood vessels that connect larger veins and arteries. It is in the capillaries that the blood gets oxygenated. In a person with HHT, the body forms abnormal blood vessels called telangiectasies when they're small and AVMs when they're large. These formations prevent blood from absorbing oxygen, thereby suffocating cells all over the body.
I was very scared and nervous. I was scared because, what's wrong with me? I can't believe there's this in my lungs. How did they get there? What did I do?
For Tim, these malformations formed in his nose, causing nosebleeds just like his father. And if that was it, Tim, like his father, would have been fine. But Tim also formed large AVMs in his lungs, blocking the flow of oxygen into the blood. This caused fatigue and left him vulnerable to illness. His body responded by producing more red blood cells to make up for the lack of blood oxygen. But no one picked up on it because all of Tim's symptoms could easily have been indicators of other, more common conditions.
This disorder masquerades for many things. In Tim, it was leukemia. In another patient, it's multiple sclerosis because they've had little strokes and they have funny things on their MRI. In other patients, it's nothing more than severe migraines. In others, they're presenting like heart failure. So it's a great masquerader.
The AVM in Tim's lung also leaves him vulnerable to bacteria and blood clots. If left untreated, he could develop a brain infection or suffer a stroke. Dr. White has to stop the flow of blood to the AVM, taking it out of circulation, so to speak. This is done with a delicate procedure called a pulmonary angiogram embolization.
One of Kathy's questions was, well, what's Tim going to feel? And I said, well, we're going to block this artery through the little catheter that I put under local anesthesia in the groin. And in fact, Tim's not going to feel anything.
At that point we had a better understanding of what it was.
I told her, I said, this is what we do. And we have 8 centers in the United States that do nothing but this. We haven't had a death doing this procedure since the very beginning.
In March of 2000, Tim arrives at Yale New Haven Hospital for the procedure.
They put me on the bed and they brought me in. And I said to my parents, I said, all right, well, see you later.
These pulmonary malformations in the lung are short circuits where blood bypasses the capillaries and goes back to the left side of the heart. So our job is to block it safely. First we get pictures, and we put our catheter in, we neatly pack so we get a cross-sectional occlusion of the artery. We do it all with fibered coils. Once the artery is occluded, then blood will flow normally through his lung.
After 2 hours, the procedure is finished, and it's a success. Tim is released after just 1 night in the hospital, and Dr. White tells the Donovans to expect to see a big change.
It was instant, the results. It really was. It's amazing.
I had more energy to run, and I could run now and not get out of breath.
Today, Tim is a healthy 19-year-old college student and a member of the HHT Foundation co-founded by Dr. White. Tim is no longer experiencing symptoms of his condition, but he must continue to make regular visits to an HHT center to keep the disease in check.
Every patient needs to take antibiotics for the rest of their life before going to a dentist, even after treatment, because there are always tiny pulmonary malformations present. So that's the major precaution. Other than that, there really are no precautions. Tim's prognosis is excellent.
This experience has changed me in a whole lot of ways. I think about life a little different now. It brought us as a family closer together.
My mother always told me to listen to your intuition, and I listened to my intuition.